how's it going? We're going to talk about one of my favorite topics. We're going to talk about fear, anxiety, and stress in veterinary patients. So, question, show of hands. How many of you have ever been admitted to the hospital for some sort of procedure, outpatient? That's almost everyone, right? Okay. So think about when you were there. How did you feel emotionally? Was there some element, any element, the highest element of fear, anxiety, or stress? And how did you cope with that? How did you deal with that emotionally? I think so often we forget that our animal patients have no idea what they're doing in this strange new environment, no matter what, even the ones that look the happiest and that are wagging their tails. There is always some underlying element of fear, anxiety, and stress in these patients. And the more that we learn about the physiology behind this, the more better adept we're going to be at helping to alleviate all of these symptoms in our patients. So why should we learn about all of this? Well, decreasing or eliminating fear, anxiety, and stress in patients will lead to a more positive hospital experience. Once we understand these physiological consequences, we're going to quickly understand how important it is for the well-being of our patients and our hospital staff. Opting in for sedation and anxiolytics early on are going to help prevent the signs of FAS. It's going to help us save time struggling with patients, making them more upregulated, increasing the need for higher doses of sedatives, which I'm going to talk about a little bit more in the next lecture. Minimizes injury to staff and the patients. And of course, just education. The more you learn about all of the medications that you administer, the safer the process is going to become. So let's first go through some definitions, because there's a lot out there. Depending on what book you read, a lot of them can be very different. So stress, this is a widely used term for describing a complex response to various stimuli. Some can be pleasant and some can be aversive, and we'll talk a little bit more about that. It's activated by emotions, mainly fear and anxiety, to assist the animal in coping with the emotion. And this is considered a normal, healthy response. Immediate stress response is normal and healthy. Now, distress is when a behavioral or physiologic response have an actual deleterious effect on the patient's welfare. And when the coping response is unable to eliminate the source of fear or anxiety, the coping response can then be activated for a very long time. And our challenge in veterinary medicine is, when does this good stress, when they come in and we know that this is a normal response, actually become distress? Okay, so fear. An emotion that induces an adaptive response, enabling the animal to avoid a potentially dangerous situation. It's initiated when an animal actually perceives that threatening stimulus. If it's unable to remove itself from the environment, now this is when it starts to lead to chronic states of anxiety and what we experience as aggression. Anxiety is an emotional response to a stimulus or may result from the inability to escape or control situations that elicit that fear response. So this is where we can see things like when cats are spraying at homes. And then there's caregiver stress. So we all work in acute care environments, right? We cannot completely eliminate the causes of stress, of injury and disease, but we can admit that our patients are sick and that all hospital interactions are or can be scary. And this is an expectation that we can work with. Being held to the idea that we need to eliminate anxiety and stress is not realistic, and this results in hopelessness and frustration among staff. So we have to admit to ourselves that our patients are going to experience stress of some kind, but how can we lessen that? Or how can we help mitigate the effects? So what are some of the causes? We have separation from owner, number one. That's going to make a lot of patients very anxious. Their environment, so we take them from being happy in their home and putting them in a hospital where they are surrounded by a ton of unfamiliar animals. All this new stimuli, all of a sudden, for us, it's super routine for us to place IV catheters up to 10 to 20 a day. For that animal, that could be the first time that's ever experienced that. Our noise levels. Noise levels is huge in animals. They hear a lot more than we do. And for us, what's a normal volume can be super loud to them. And then we put them in a constrained environment. We have to have them in cages. So trigger stacking. Has anyone ever heard of trigger stacking? Yeah, cool. So this is the contribution of cumulative stressors in behavioral reactions in animals. So these triggers are basically any stressor that increases fear or anxiety. So we all experience this too. So basically how it works is this purple guy. So that might be that you wake up in the morning and you go to take a shower and there's only cold water. And then the green guy, you're driving to work and someone cuts you off and you almost get into a car accident. And then that orange guy. So then you get into work, you go into surgery, none of your patients are soaked. And then the surgeon comes in and says, why isn't my first patient down yet? And you respond unfavorably. So it's the accumulation of all of these things where if it was just one thing, maybe if those other things hadn't happened to me that morning, I would have said, well, I'm waiting for one to get soaked. But instead, you respond in a way that is because of everything else that happened. So for animals, it might look something like this in the hospital. So they're all of a sudden in a strange place, it's super noisy, and they just got hit by a car. That is going to take the dog who has never bit anyone in their life, and when you go and ask the owner, is your dog nice? And they say, yeah, no, he's super nice. That's going to cause that dog to potentially bite without any warning. So that's how trigger stacking works. So we can't avoid hospital triggers. These are life-saving procedures that we have to do to our patients, but we can control the duration, intensity, frequency, timing, and number of triggers that they do experience. So how do we control some of these triggers? We can keep the patient with the owner as much as possible. We do not have to tear them away unless we absolutely need to. Anytime you can bring them back to their owner, go for it. Minimize the number of interactions with strangers. Sometimes that's unavoidable. Minimize their unfamiliar areas. Again, sometimes unavoidable. But also keep handling to a minimum. So now think back when you were, for those of you who were admitted to the hospital for something, think about how did the day go? Was every hour another nurse or another doctor was in interrupting you, potentially interrupting your sleep and giving antibiotics and doing a PE, getting you to walk around? Or were they clumped together? Was it every 4 hours, multiple people came in and did everything, all the procedures they needed to do, and then left you alone? If we think about our animals in terms of that, they're going to respond a lot more favorably, and they're going to have much more decreased anxiety. So that's always something to consider. Reduce our noise, smells, and visual stressors, and I'll get into more of that in a little bit. And our goal is basically to keep that trigger stack as low as possible. So let's go into some physiology, so the stress body response. So basically, the animal has something stressful that happens. It in turn stimulates their neuroendocrine system and their autonomic nervous system and their immune system, and then we get a behavior. So it begins in the central nervous system, and it perceives a potential threat to homeostasis, and it's modulated via two different systems. So the sympatho-adrenal medullary system, which we call SAM, and the hypothalamic-pituitary adrenal axis. So the SAM system, this is what mediates fight or flight or freeze. Everyone's heard about that, right? So it activates the sympathetic nervous system, and then we have this catecholamine release of catecholamines like norepinephrine and adrenaline. And what this does is it results in mydriasis, right away when you look at a cat and its pupils will just get huge. We see all these increase in subjective and objective vitals, like increased heart rate, increased blood pressure, respiratory rate. Glucose, right? The reason why this stimulates glucose is if an animal is being put in a position to either fight or flight, they need that heavy glucose circulation. And I just want to touch on gabapentin for a moment. I'm going to talk about that a lot more in the next lecture when we talk about sedative pharmacology. But I just wanted to share a story. I have a work associate who brought in her cat about a month ago, and she said, God, every time I bring in this cat, her glucose is like almost 200. She is so stressed. It's so traumatic for her. So I said, why don't you try giving a dose of gabapentin the night before, morning of, and just see if that just eases her anxiety a little bit. And the most interesting thing about it was when she took her blood work, and the cat was totally normal, she was just rechecking blood, her glucose was 84. For the first time ever, this cat whose glucose was always almost 200, her glucose was 84 after giving gabapentin, and I love that. Like, that is the best representation of what a true anxiolytic gabapentin is, and how if we just educate our owners on that and we start incorporating these to-go home meds, what a difference that can make in patients' anxiety. It causes vasoconstriction, hard to place IV catheters, puts them in a real alert state. And so now the hypothalamic-pituitary adrenal axis, this is a slower response to a stressor. So this is mediated more in hours to even days in some patients. This doesn't really have to do with the fight or flight. And this originates in the hypothalamus, and this is where we see the cortisol release, right? We always associate high cortisol with high stress, but we don't routinely measure cortisol in our patients to see how stressed they might be. And even if we did, if a patient has been hospitalized for a long time or has had anxiety for a long time, they could even have adrenal fatigue or adrenal exhaustion, where if you actually do measure their cortisol, it might actually be low. So that's always something to think about. And we care about glucocorticoids because they influence protein, glucose, fatty acid metabolism. It suppresses GI motility and causes ileus, and also can cause dysregulation of your glomerular filtration rate. So altogether, these hormones can influence growth, thyroid function, reproduction. So then there's physiologic versus psychogenic stress. So physiologic stress is the exposure to a positive or negative physical, systemic, environmental change that somehow perturb the body's homeostasis. And this is induced by illness, trauma, and surgery, all things that happen at our hospitals, right? So psychogenic stress is the exposure to psychological or social challenges, which results in disruption of an actual psychological well-being. And so there is such a thing as positive stress, whereas negative stress is all the things we talked about, separation with their owner, all these invasive procedures, being confined. But positive stress are things like when the animal reunites with the owner, or when a dog is playing fetch, or for people, why we go on roller coasters or go, skydiving. These are all things, it's still stress. We're having the same physiological response, but some of it can be enjoyable. To some people, I would never go skydiving. So basically, an animal comes into the hospital. It is perceived as a threat. We have all of these things happening to the patient, all these subjective and objective things that we can see. They end up having a decreased rational thought. They also have memory consolidation, which is super interesting. Like if you're in a stressful or fearful environment or something traumatic happens, your brain tells you to remember what's happening, like really remember it. So that's also awful for our patients, and that's why people, try to fake their animals out that they're not going to the hospital, because it can start right when they leave the house. But in turn, all of this ends up in a behavioral response. So often when we are calling our animals aggressive or, oh God, that cat is a major caution, and we just shake it off, these animals are scared. They are fearful, and they have high levels of anxiety. So in turn, furthermore, for the consequences, there is susceptibility to infection and sepsis. This is really bad for our critical patients who are trying to heal. We have impaired antibody responses to vaccinations, delayed wound healing, development of GI ulcers, and that's a lot of times that's from that cortisol release. Long-term stress can cause cardiovascular changes, and overall an increased morbidity and mortality. And anesthetic consequences. I'm an anesthetist, so I have to talk about anesthetic consequences. So if you admit a patient to the hospital, even that morning, or it's been in the hospital for a few days and waiting to get a procedure, this animal is experiencing anxiety modulated via those two systems that we talked about, right? So the immediate one for the SAM, and then the HPA axis a little later on. So what's happening to them is they're having all of this cortisol release and catecholamine release. It doesn't matter if they're not stressed, right? They can be in that freeze period, and they can just be sitting there, like releasing all of these catecholamines. So what happens is that they can exhaust their reserve of catecholamines before you put them under anesthesia and anesthetize them, which leads to further intra-op hypotension and increased need for catecholamine therapy. So how many of you have access to vasopressors or catecholamines at your hospital? Dopamine, norepi? Not too many, right? So what do you do when the patient is hypotensive and you don't have catecholamines and they're under anesthesia? You give them fluids, right? You just bolus them. The doctor says, give them a bolus, give them an IV fluid bolus. Well, in the past 10 years or so, this is everything that we've been looking at under anesthesia is all the deleterious consequences of fluid administration in our patients. So if we could stop this beforehand with anxiolytics and with more fear-free techniques that we'll talk about, that could actually make anesthesia safer for these patients. Does anyone have any questions about that? Okay. So recognition. All right, so we know now what it does to the animals. So how do we recognize it? So there's the fight behavior. This is pretty obvious. They'll be lunging and attacking. There's the flight, and these are those escape attempts that you'll see where animals get off the leash and they just bolt. The freeze behavior, which is crouching or hiding, and I can't emphasize this enough. So many of our patients that we say, oh, this cat is so good. This dog is behaving so well. They could be like screaming on the inside. That could be a freeze behavior. So we shouldn't necessarily omit anxiolytics and fear-free techniques in these patients. And fidgeting. This is actually the most common sign that you'll see. This is when animals will pace and circle, yawning when they're not tired, scratching if they're not itchy. This is kind of the human equivalent to someone biting their nails. And this is actually what animals perceive the most, but we might miss because they're a bit more subtle. And then there's the canine ladder of aggression. So this displays typical canine body language associated with that they experience when they experience fear, and then it eventually leads to aggression. So understanding animals' behavioral cues will help us figure this out. And I can't emphasize this enough. So when a patient is, let's say a dog is growling at you, and our instinct is to say no, no. When you punish these types of early signs and these behaviors, the dog is potentially going to listen to that. And what that means is the next time that the dog is feeling fearful, he'll skip the growling and go right to biting. So we never want to punish these early signs and these early cues, because that in turn is going to actually put us in further danger. So here is a behavioral video. Fear in a dog. So some people just might say, oh, that dog's so excited. He really wants to get out and run. But this is a highly anxious dog. So how else can we recognize? Even if you haven't worked with animals for terribly long, it's that, yes? Okay, so the question was, instead of punishing the animals for growling, what should we do instead? And you're exactly right. Yeah, you just have to take a step back, calm down, slow down, and try to maybe approach that animal from a different side. Maybe if what you're trying to do is place an IV catheter, you have a muzzle on the dog and it's growling, maybe stop and ask the doctor for some medical intervention. Just take a different approach. I'm going to talk about that a little bit, how we can take different approaches. That's a very good question. So yeah, even if you haven't worked with animals for very long, it's not hard to recognize the difference between a really stressed dog and a totally happy, relaxed dog. But there are more subtle signs that we can take into consideration that I was never taught, and that I'm sure a lot of you weren't either, that it's really important to know and to recognize. So initially, went right to barking. That is actually considered a flight attempt. So this dog is stimulating his sympathetic system and crawling into the owner. Right now, that's considered a flight attempt. And this is as well, hiding under the owner. These are flight attempts. This is a very anxious dog again. Okay, so what about cats? So their fight behavior, this is the vocalizing, attacking the front of the cage when someone walks right past it. The flight behavior, escape attempts, the ones that we have to put on their cage that say, will bolt, the second you open the door. The freeze behavior, it's really subtle in cats. I can't emphasize this enough. It's just crouching, hiding, or even pretending to sleep, but they're actually not sleeping. And then fidgeting, which really can be seen as just if the cat's pace in the cage, or if they're tachypnic, but there's no pathophys behind that. There's nothing wrong with their respiratory system, they're just tachypnic. And then there's genetic traits that trigger stress as well. So cats are both predator and prey. So when they're unsafe, their prey response gets triggered, and they want to flee first. Those are the cats where you open up their carrier and they just jump right out and then go underneath the cage. And they're highly sensitive to changes in the environment. All of these unfamiliar smells and sounds are going to upregulate them. And again, they're solitary hunters. They're not used to other cats. So especially even if you have separated wards, which is great to have a canine ward and a feline ward, cats are still going to be stimulated by the other cats and their pheromones in the wards. So this is an example of freeze behavior in a cat. Licking her lips, that's a sign of anxiety. And she's actually, because she's not given a place to hide, she's just trying to hide underneath that towel roll. And you maybe can't see it, but this cat is also tachypnic, but there's nothing wrong with her respiratory system. And right, this is a cat that we might all see, and it's like, oh, this cat's so good. What a good patient. But she's actually very anxious. So more recognition that you'll see sign in cats. Stressed cats, the ears out to the side can either actually mean pain or stress. Mydriatic pupils, take a look at their tail for sure. If you see that real piloerection, their body will be crouched and their backs will be arched. Okay, so true or false, holding and lifting a cat by the scruff makes them feel secure because this is the way that they were carried. Oh, great, everyone already knows. No, that's false. And I've been practicing medicine since 2002, and it really wasn't until the past about 5 years that really came nationwide, and everyone is saying, no, we cannot scruff cats. But for that whole time in my career, that was just I was told that was the safest way for cats. And it's incredible now how much more knowledge we have and how inappropriate that is for cats. So we want to support all the body parts. I don't care if it's a kitten or a geriatric, they need to be completely supported. I'm going to give you some resources, if you don't have them already, on alternatives to scruffing. And we want to always provide the cat with a choice. Like I was saying, if you go in one way and it's reacting unfavorably, take another route. Maybe if there was 2 people going in, one of them goes away and you try to get the cat by yourself. Always put soft material on tables or surfaces. Those, cold metal surfaces are very anxiety-inducing for cats because they really can't get their grip. Always utilize touch gradient. Does everyone know what touch gradient is? Some yes, some no. So it's when you're actually, so if what I want to do is give an IM injection, maybe in the epaxial muscles. So I want to stroke the cat first, down its head, down its back, and just kind of massage that area first and then give the injection, instead of just going up to the cat and injecting it out of nowhere. And you can do that with basically anything you're doing. Even if I'm going to auscult an animal, I'll let them sniff the stethoscope first and then just kind of put it gently down them and down their chest until I'm finally there. Once you get a hold of touch gradient, you'll see what a difference it makes. So approaching a cat. So slowly blink your eyes and close them a little. Cats do this to each other to show that they're peaceful and happy. Turn your head slightly. A direct stare and directly going at a cat is going to be perceived as a threat. Even turning your body to the side instead of facing it front on. You can open the cage or carrier and wait. If they are able to eat, offer a treat, coax them out. Just take a temptation and break it in half. Every cat is going to go for that. And always keep your hand below a level of a cat's head. I mean, myself included, I'm constantly going to cats and want to be like, I love you, and just pet it right from the top. But cats will see that and freak out. You always need to let them sniff your hand first and then respond to them. They're going to tell you if they want you to pet them or if they're like, no, I'm not handling pets right now. So when you're approaching the cat, you want to stop and reassess if the cat is trying to distance himself from you. You're seeing that piloerection and all their fur standing up their back. Check out their tail. that cat is whipping its tail around, it is not happy. If their pupils start to get mydriatic and they're directly staring at you, any vocalizations, and that's pretty obvious, right? And if their weight is shifted off their front paws, right? Because if they're just leaning in and then all of a sudden they go to lean back, that means they're getting ready to attack. And if their muscles seem tense, that's pretty obvious, right? Like a cat who's relaxed and the cat who's ready to either fight or flight. So how do we prevent it? So we're going to talk about utilizing fear-free techniques from the start of patient's arrival. By show of hands, how many of you are fear-free certified or you use that in your practice? Okay, a good amount of you. So I'm going to talk a little bit more about that. We want to avoid loud noises when possible. I know that can be easier said than done, but having white noise machines in your hospital is a game changer. Utilizing feel away and adaptics. So when we, at the ASPCA hospital, when we start out in the morning, we'll have separated in our treatment area dog cages and cat cages, and they'll be sprayed with pheromones. The only times we won't put an animal in them is if they have some sort of respiratory distress. And we want to use minimal restraint techniques. We want to be able to increase predictability and routine in the environment if we can by getting all their treatments together instead of all separated throughout the day and night. Have the environment include their own scent. So those owners who always say, can I leave a t-shirt with him or something? I always say, yes, yes, please. That really is going to ease their anxiety. You know, obviously just say, we don't know if you're going to get it back. But most owners wouldn't care. Reduce noise level with white noise machines. Offer things like positive enrichment to make their experiences more positive. Provide hiding spots with cats. There was a study that was actually done that measured stress response in cats in the ICU between ones who did have boxes, cardboard boxes, and ones who didn't. And it was about a 40% difference of reduction of stress and anxiety for the cats who had boxes. If your cages are too small to have those cats hide in cardboard boxes, cover up half the cage with some sort of cage paper or something. So that way they have the option to hide if they want to, or the option to be like, okay, what's going on? We want to provide outlets for natural behaviors, so scratching posts for cats and toys if they're feeling well enough. Cover all cages for transport with a towel. And have a familiar person present to examine the carrier when at all possible, to have the owner there. And the low stress handling, touch gradient, towel wraps, and the such. Okay, so I'm getting over to a video.
It is time to go fear-free. Find out what's causing anxiety and stress in your practice on this edition of NAVC Spark, your veterinary news, your veterinary life. Hi everybody, I'm Kara Moore. In this week's Spotlight story, Dr. Marty Becker is on a mission to transform practices into fear-free environments. Find out what simple changes you can make for less stressful and more effective exams. A trip to the vet can be a traumatic one for patients.
The people will get the carrier out the night before, the morning of. They stuff the cat in there. They don't preheat or pre-cool the car. They baby talk it on the way in. When they come in, they check in and they wait in the reception area with a lot of other pets and a lot of other people. It's just like a perfect recipe for fear, anxiety, and stress.
And in return, the pet's turmoil can cause an ineffective exam.
When pets are stressed, their temperature goes up. So you might take a dog or cat in, and their temperature is 103, and their temperature should be 101.5. But is it stress, or is it early sign of a fever? Or the pet is limping at home, or you touch it and it cries out in pain. You take it to the vet, and you can't reproduce it. It's not limping. You can push your finger almost through it and it won't react.
Dr. Marty Becker says one of the keys to developing a fear-free strategy is working with pet owners.
You get the carrier out a week out and you put high-value treats in there. You start this magic carpet ride of pheromones from carrier to car to clinic. You have the pet come in hungry, so you withhold food for 6 to 12 hours before they come in. You preheat or pre-cool the car. You cover it with a sheet to reduce visual stimuli. You play a special calming music that we send you. We can send it an MP3 file, or when you come in to pick up something, give you a blank CD to put in. When you come in, you go check in and go back out and wait in your vehicle with your pet rather than in that stew pot of stress.
And implementing this initiative does not take any extra time or cost a lot.
People think, oh my gosh, you got to buy more treats, you're going to have pheromones and stuff. We figured out it costs about $1 per pet owner. So if you're charging $40 for an office fee, if you charge $41, you would cover all your costs.
Dr. Becker says by paying more attention to the emotional well-being of patients, you'll have better results.
Your physical exam is more normal. The blood chemistries are more normal. You don't see the stress shift and see high glucose levels. Instead of the spleen squeezing out and increasing the red blood cell count, it's more normal. So it's just better medicine.
To learn more about Fear Free and how to make it work for your practice, go to fearfreepets.com.
I swear I don't work for Fear Free. I've just really seen at the ASPCA hospital, this is when you're onboarded in your first 2 weeks of orientation, this is the first thing that you go through, is going through the Fear Free modules. And I can't tell you how much that our hospital has completely changed because of it. It really is such a benefit to hospitals. If you go to fearfreepets.com, they also have a bunch of free resources. These are ones that when I saw, I printed them out right away, laminated them. So similar to the way that you would have patients' pain scoring, Q 4 to 6 hours, and using the CSU or the Glasgow pain scales, there's actually a way to measure FAS scoring. So for your patients who you're worried about being anxious, or you want your nurses to take a look at a little closer whether or not this animal is either anxious, dysphoric, or in pain, you can also have them score the spectrum of fear, anxiety, and stress. And so these are just the highest ones, but it's on a level of 0 to 5. And so we as nurses can help determine this for the doctors and let them know if their patients are highly anxious and maybe need some more intervention. Look at that. So this is that touch gradient that I was telling you about before. There's no sound for that, that's okay. So this is a really great fear-free way to examine a cat. It's in its carrier. It's with the owner feeding it chicken juice, I don't know. But the cat is really digging it. And see how he let the cat sniff his stethoscope, and then you just put it down the cat's chest. And this is a real great example of a fear-free exam. And this is something I feel like that we can all do in our practices if they're not pre-op. And I know everything does take a little bit more time, but it really is, in the end, worth it. Yeah. Okay, so how do we treat it, right? So it's happening. How do we treat it? We can't always change our environment. Like I said, we're giving life-saving procedures to these patients. And all this novel stimuli and noise, it has to happen. And fear, anxiety, and stress can definitely remain in the face of fear-free techniques. So what we need to do is opt in for sedatives and anxiolytics early on, not after the fact. And of course, knowledge of sedative pharmacology is imperative. And just a note about return visits. So you see a cat or a dog, and you know that they're either going to come back, either for a bandage change, or maybe you're scheduling them for a cystotomy. Always consider pre-hospital anxiolysis. Send that animal home, send that owner home with either trazodone or gabapentin for their animal, and instruct them to give it at least 2 hours before they come back. So recently at the ASPCA, I worked with a doctor to create what we call fear-free packets, to-go-home packets, and we made them for dogs and for cats. And for dogs, we give them trazodone, and for cats, we give them gabapentin, and depending on their size. We have handouts for the owners with also links to how to pill animals, and we also give them pill pockets in the packets. And these results have been absolutely incredible in the difference with these animals come in already on an anxiolytic, versus us giving to them once they're already traveled or at the hospital experiencing all this novel stimuli. So here are some great resources if you guys want to take a picture of this slide. The top 3 Sophia Yin's, these towel wrap techniques are amazing. The World Small Animal Veterinary Association, I love this website. They have so many incredible resources there, especially their pain guidelines. But this is a really great one on, if you just go to the site and go to all their guidelines, their behavioral and animal welfare guidelines are amazing. And even at the ASPCA, if you go to ASPCA Pro, we have a whole behavioral department where they put up a ton of resources for hospital staff and for owners. But any questions that you had that I didn't answer, we can answer after the next lecture. Thank you.